I'd like to welcome everyone. I'm Nathan Stoll, the chair of VLab. VLab for 30 years has been an all-volunteer 501c3 nonprofit that's connected innovators, investors, experts, and curious minds to explore disruptions when they're near their inflection point and discover insights from founders before they're household names. As people worldwide have been dealing with the COVID-19 pandemic, we obviously have an enormous disruption that we all face together. Our community at VLab regrouped to organize virtual events. This is our first virtual event that are relevant now during this disruption. Today's topic is thus highly relevant: digital contact tracing and blazing a trail back to normal. I will in a moment introduce our moderator, who will go a little deeper into the topic and introduce our panelists. But before I do that, I'd like to briefly say a huge amount of thanks to all of our sponsors at VLab, as well as all of you who, many of you made donations today. We usually receive a lot of our funding through ticket sales. So thank you for your donations to help VLab put on more of these types of events and keep ourselves going. I'd like to extend a special thanks to our programs chair, Ravi Prasad, and our event chair and team, Hira Dangle, Doug Berman, Ksenia Zvakatseva, Sunil Ravapati, Val Gerdes, and Sheen Kao. And so without further ado, I'd like to hand over to Dr. Thomas Kingsley of the Mayo Clinic, who will introduce digital contact tracing. Thomas?
Thank you, Nathan, and thank you, VLab, for having us, myself and a great group of panelists, talk about this important topic. Digital contact tracing is one important piece of this puzzle of addressing the COVID pandemic we're currently all in. And we typically talk about different approaches to addressing an emerging infection. And one, oftentimes, especially with a viral emerging infection, we talk about non-pharmaceutical approaches because there's often non-pharmaceutical, there's not a lot of drugs yet in development that can impact the disease. And so oftentimes we're left with a lot of approaches that are approaches we've used for hundreds of years in making an impact on an emerging infection. And so some of those I just want to quickly talk about because it relates to this digital contact tracing is, the primary goal is to prevent spread. And we do this from removing infected people from a susceptible population. And we can do that through what we're currently doing right now in the United States, which is social distancing and isolation as a strategy. And this typically works. Isolation is somebody who is a known infected individual and removing them from the population. But you need really good testing for this to work. And also contact tracing is really important here because once we've identified infected individuals, not only having them isolate themselves from the population, but also contacting all the people that they've exposed and getting them to remove themselves. And so this strategy is really good for keeping the economy open. It allows people to leave their house. The other methods, so quarantine is often what we do when, especially for infectious disease where people become very infectious around the time that they also become infective. They can often identify themselves as being infected and remove themselves from the population. And then stay at home, which we all just kind of experienced in the United States, is a strategy that's oftentimes used early on in an emerging infection when we haven't yet established different approaches to dealing with it. And we basically ask entire populations just to remove themselves without knowing whether they're positive or not. And so this graph here I have on the right is of Minnesota, where I live and work at the Mayo Clinic. And you can see that, early on in COVID, we had a spike And then the stay-at-home orders for Minnesota happened late March, early April. And there's a little bit of a lag, and we started to finally see that curve starting to come down. And then we've opened up society again in Minnesota, and now we're starting to see that growth. And despite contact tracing efforts and some of the social isolation. So I'm going to move to the next slide. And here you can see the importance of these methods in reducing what we call the reproduction number, which is what basically one infected person, how many subsequent infections are they going to cause? And so you can see the difference in reproduction number between a reproduction number of 4 and a reproduction number of 1 in this graphic, making contact tracing, reducing that reproduction number is really important in reducing the growth of the disease in the population. So the question is, why is COVID so challenging? We faced a lot of emerging infections in the past, and some of these that you'll see on the screen have been really serious diseases that as humanity we've struggled to tackle, but COVID has been particularly challenging. And I actually think the answer to this question is partly the reason that I think digital contact tracing can play such an important role. And so you can see on this graph, the bottom part of the screen, I think contagious got cut off, but the x-axis is how contagious each of these infectious diseases are, and on the y-axis you have mortality. And you can see COVID just kind of fits in the middle of the pack here. Something like Ebola, which is both more deadly and more contagious, clearly didn't have the same kind of impact on society. And so some of the reasons I think that is, I also think of the reasons that this technology is a kind of a perfect use case for digital disruption. So with COVID, what we've seen, especially we're learning more recently, is that a lot of transmissions, some estimates up above 50%, are in a pre-symptomatic and asymptomatic stage, or mildly symptomatic. And this makes it really challenging because many individuals are spreading the disease unknowingly, and there's a lot of people out in society that are infective. And this is actually fairly novel in terms of when you compare it to a lot of other infectious disease. And this makes identifying contacts really, really hard. And so when we do manual contact tracing, which is someone from a Department of Health typically calling someone who is tested positive and trying to figure out who they've exposed, when you have somebody who's been out in society, probably infecting people for days, trying to get them to describe who they've been in contact with is really difficult. And this is something where app technology really lends itself well. And one of the other parts of this is that there's a delay in contacting those people that have been identified as an exposure. And this is another aspect where this technology can do that instantaneously, and so prevent that delay that we're seeing even with manual contact tracing. And so it can really supplement what we're already doing in departments of health around the country. This graph here is just showing that as we've opened up society, what we're seeing is that more and more of the cases can't identify upwards of 30% of their contacts, or that people that have been infected do not know who infected them. And so it's really, the other thing that's challenging about COVID is it's really split the population into what I would say is vectors and victims. What we're seeing, this graph is from Minnesota, but if you look at other states around the country or countries around the globe, you will see this as well, is that a lot of the young people are the ones that are carrying the disease, where the disease is the most prevalent, but the population that's being affected are elderly, and that's where we're seeing most of our deaths. And so I think another example of why this technology could be useful. We have in Minnesota really high smartphone adoption, upwards of 80% of the total population. But if you look in our younger population, that percentage is even higher. And so it's a good use case. And so there's different, sorry, just skip the slide here. So there's different strategies to doing digital contact tracing, and we're going to talk a lot about that tonight, and I'm looking forward to having our panelists weigh in on this. But two big buckets I just want to bring up are kind of what we call a decentralized approach versus a centralized approach, and that's really a topic around data privacy. And so, when we first started seeing this technology come out, we started seeing it in places like South Korea, where the government was taking a lot of personal identifiable data and putting it in one place. And so there wasn't a lot of privacy, but what we did see is it was fairly effective in terms of addressing or doing good contact tracing or helping their contact tracing efforts and reducing spread. In countries like the United States, data privacy, we emphasize that. And so there's been different ways of trying to deal with that. And one of this approach, what we're seeing with like the Apple Google API, and we can talk about that later, is this decentralized approach, which is keeping that data on the phone and basically not having these breadcrumbs between these contacts. And so the phone isn't really tracking your location per se, but it's just helping you identify when you've had a meaningful exposure, keeping that on the phone, and then letting people know later on. And so I want to stop talking now and move over and introduce to our panelists that we have. So we have a great group here. First, I want to introduce Ramesh Rasker. He is founder of Pathcheck, an MIT Safe Path, and an associate professor at MIT. And then I would also like to introduce Clint Van Marrewijk. He is founder and CEO of SaferMe. Mo Islam, he is a partner at Threshold Ventures. And George Rutherford, he's an epidemiologist at UCSF. I would like to give Ramesh an opportunity to introduce us to his work with Safe Paths. This is really exciting. Ramesh, would you tell us about this?
Thank you, Tom. Wonderful to be here. Thank you, VLab. What strange times we live in. So let me tell you about the Pathcheck Foundation, which is effectively an incubator, an open source incubator for any team that wants to build solutions for COVID-19. Very quickly, it has become the world's largest nonprofit open source incubator for COVID-19 solutions. And in the beginning, the emphasis is on exposure notification and case management, which is things beyond exposure notification. And then emphasis is on solutions for public health as well as back to work solution. So contact tracing, as Tom explained, is use the smartphone to use some kind of a proximity technology, let's say Bluetooth. Step 2 is notify if you have crossed path and provide some context, maybe location as well. And step number 3, which is not solved very well, is how to provide meaningful tools for public health and businesses for coordination. And this part nobody has solved yet. So we'll talk about that a little bit. So a Pathcheck platform has 3 aspects to it: the app itself, the underlying technology, and then the dashboard, right? So the app has exposure notification, ongoing tracking, personalized guidance, symptom tracking, quarantine verification, and so on. And on the right, you have the dashboard to improve the tracing conversation, hotspots, spread prediction, coordinating at-home population, and so on. And then in terms of the platform itself is agnostic to what proximity technology APIs you would use, GPS, Bluetooth, Wi-Fi, QR codes, and so on. And all this code base is available for you to play with. So the way it's set up is we have our flagship app called Pathcheck Bluetooth or Pathcheck GPS, and that we're making available to states and nations. At the same time, other teams are using our code base to launch their other solutions, maybe for a university, maybe for a hospital, maybe for workplaces, and so on. So I won't get a time to talk about how all those other solutions work, but let me talk about the solutions for states and nations. So the question is, what should be in a smartphone solution? So the first thing is obvious, it should be open source. So there's some trust, vendor lock, shared learnings. If you implement for Thomas from Minnesota, if you want to go to Wisconsin, why should you start all over again? You should be able to take the same, pretty much the same base and make minor modifications and use it for Wisconsin. Number two, this is kind of a unique point, which is that it should be built by a nonprofit because the data can be misused. And even if you use the Google, Apple APIs, which supposedly is very privacy preserving, the metadata, such as IP address and what brand of phone you have and what data plan you have when you charge and discharge the phone. I mean, you need all this information for an app to function. So that metadata can get leaked. It is getting leaked, sorry. There's nothing you can do from leaking it. And then if it's a for-profit organization and it's using ad tech data, advertising technology data, then it can just suck up the data from every other app the user is using, which could be a weather app or a delivery app or dating app or whatever it is. And you can overlap the two and very quickly figure out what this user is. And if we have 60% adoption of these apps, then a single company, a single startup can have this unprecedented view in 60% of the population. And there are only a handful of apps out there beyond Google and Apple, like Facebook, maybe TikTok, and so on, that have that kind of penetration. So if a for-profit suddenly has this contract to deliver an app for a state, 60% of the population, we will be in deep trouble, especially with the data breach or the rogue employees. The next point is that it should be interoperable across states and nations and other things that you would imagine: privacy preserving, connect to public health, language support, and modular. And so Pathcheck is an MIT spin-off. A lot of my research as an MIT faculty is on privacy, digital health, and machine learning. As I said, we had to spin it off out of MIT, become a world's largest effort. And it has 50 full-time people who work, like top CEOs, CTOs, epidemiologists, privacy, legal, ethicists. But we have also raised a few $1 million of long-term philanthropic funding, and that's used to support a full-time software engineering team, because it's difficult to do high-quality software engineering without significant funding. And then we have contracts in multiple U.S. states and nations to deploy their app. And in Apple Google terminology is called entitlements. So we have the entitlements for multiple jurisdictions. And so we need three parts: the app, the server, and the dashboard. And so this is being deployed as we speak and being piloted in many places. And then also we have pretty large R&D because this is a completely new regime we are in. Digital contact tracing, exposure notification, case management is a whole new field. There's no playbook for it. And that's why we need a lot of R&D. So you might have seen some apps coming out of Europe saying, hey, there's an app, 20% download. But it's not clear if they're working right, because the plumbing between the app and the server is actually quite challenging. For example, Google is releasing its APIs. Google is releasing the server code base. It was 1.4, now it's version 1.5, and everything stops working. If you have an app that was developed for the previous server code base. And so everything is moving in real time. How do you actually convert those Bluetooth measurements into something that's important for epidemiology. For example, if you're exposed, let's say there was an infected person, you're exposed, you don't have to worry about it right away because it's going to take 4 more days, between 4 to 7 days after exposure is when the individual is most infectious. But within 4 days, there's nothing to worry about. Or beyond 7th day or 10th day, there's not much to worry about. So we had to kind of tune all those algorithms to get going. Same thing with encryption. You might be encrypting the Bluetooth data, but what about the rest of the context? Maybe your zip code, maybe your location, maybe your symptoms, and so on. So there's a large R&D that needs to take place, and we're doing everything in open space. So just to summarize, Pathcheck launching its own app server dashboards for many states and nations. At the same time, it's the world's largest open source. So if you're thinking about doing a startup or a for-profit or non-profit, you're welcome to use this as an incubator. There are many people who are helping everybody else launch their own solutions on top of this. And I really want to use the analogy of a national weather service, right? Because it doesn't matter which app you use, you can still get the alerts for tornadoes or hurricanes or any terrible weather. The difference, however, is that National Weather Service uses live sensor data and prior models, let's say for hurricanes, but epidemics cannot be these top-down solutions. Epidemics are innocent people infecting other innocent people. And so we have to treat individuals themselves as sensors. And so when Tom talks about non-pharmaceutical interventions, we have to treat people as sensors and create this bottom-up solution. And smartphones is where it can help. And Tom, I think for 18 to 64, 90% of the US population has a smartphone. That doesn't mean it will solve everybody's problem, but a significant part of the population. So I just wanted to kind of end with some suggestions. So often in a problem like this, many of us on this call, and I see hundreds of people on the call right now, often you get into this situation where you say, I can see a problem X or I can see a solution X, and what should I do next? And we have a whole formula at MIT called Idea Hexagon. Just look up Rasker Idea Hexagon, and you can take X and do some operations on it, and it'll allow you to come up with a lot of good ideas. So if you're just kind of a seed stage for your startup and thinking about what can you do in this space, use our formula. There's another tip I want to share with you. Often you think about startups in this way. On the left, we have research and hackathons and contests that are building curiosity and community. And on the right, we care about impact through startups and incubators and nonprofits and so on. And the classic formula is to first build a team, identify a problem, and then maybe come up with a business plan or solution. Unfortunately, in a scenario like we are in right now, this just doesn't work. Okay, it just doesn't work. And you have to think about a completely new model, because people who have ideas, the innovators, are not necessarily entrepreneurs. That may not be the same person. So I want you to go and look at redx.io, where we have a whole kind of a playbook for you. How can you spot problems? How can you probe solutions? How can you grow adoption and possibly even launch by the time you get into a startup or a nonprofit? So check up redx.io. So I want to thank VLab and thank you, Tom. Let's talk about how can we do exposure notification, case management for public health, and back to work solution. Thank you.
Thanks, Ramesh. That was great. I have a lot of questions to ask you, but before I do that, I want to make sure I get to introduce some of these other great panelists that we have tonight. So I would like to introduce Mo Islam. Once again, he's a partner at Threshold Ventures. And Mo, why don't you tell us about your work in this exciting space?
Thanks a lot, Tom, and thanks VLab and for putting this on, and everyone for joining. I appreciate the time. So, like Tom said, I'm a partner at Threshold Ventures. We renamed the firm from DFJ. Firm's been around 35 years. Early investors in a number of disruptive technology companies: SpaceX, Tesla, Box, Skype. So, have been investing across consumer, enterprise, and healthcare for decades now as a firm, and I've been with the firm for about 8 years now. We are early stage focused, so tend to work with entrepreneurs at the seed, Series A, Series B stages, provide capital, provide support to build up their business, and help scale into $1 billion company or more. I tend to focus on disruptive technologies, emerging platforms, and a lot of the work in digital contact tracing just has recently caught my eye. We've seen a lot of new companies get started. I think you've heard some of the great work Ramesh is doing to enable that. And then, I think you'll hear from a startup on the panel too with SaferMe. So really exciting new space, something we are getting smarter on as well. I think COVID has kind of impacted everyone in some capacity, definitely our companies, and then also our business. And so it's exciting to see companies that are enabling tools to help us come back to work. We've sort of been in work from home mode for I think a lot of folks over the last several months, and now starting to try to come back. Although like my home state in Florida has made that a little bit difficult. So I think we're still trying to figure out how to do it. But I think digital contact tracing will be an important part of it, and we're excited to learn about new companies that are enabling that to happen with software and APIs. I think it'll kind of create new business model opportunities as well. I think there are potential opportunities just in terms of selling to self-insured employers and potentially municipal and state governments. But I think there'll be new opportunities as we amass this interesting data set. So I'll stop there, hand it over, and excited to be on the panel.
Thanks, Mo. I want to next introduce Clint Van Marrewijk. He's founder and CEO of SaferMe, another digital tracing platform. Clint?
Thanks, Thomas. Hello, everybody. SaferMe, we're a contact tracing app for businesses specifically. We don't serve the public entities. We serve businesses that need contact tracing. The business owns the data themselves. And we've rolled out hundreds of times, I think it's in the thousands now, around the world. Businesses have a lot of need for internal contact tracing to keep their staff members safe. And we've got clients across the US, Europe, Australasia, and as you can hear from my voice, I'm from New Zealand. And we've got, the government of New Zealand made our product free for any business in New Zealand as well. So I'm interested to dig into the learnings we've seen around the world. Obviously, there's different things happening in different places, and I'm happy to share what we've learned, and I'm really keen to learn from the group. So back to you.
Thanks, Clint. And so we have one more panelist I'm really looking forward to hearing from. Ge's also in healthcare like me, so really excited to get his perspective. Dr. George Rutherford from UCSF. George, are you on?
Yeah, thank you. It's great to be with everyone this evening. I'm a professor of epidemiology at UCSF, and I'm the chief of the division of infectious disease and global epidemiology at UCSF, and I'm attending in pediatric infectious diseases. But my background's been in public health for years, decades, and I've done contact tracing for everything from measles to gonorrhea to syphilis to Ebola in Africa and HIV in Africa. So I have a kind of a clear idea of how complicated it is, how labor intensive it is. And I'm delighted to hear about new technologies that can remove at least some of the workload. As we talk, I'll talk a little bit more about the people whom we're contact tracing and how likely it is they're going to be holding this technology in their hands. But I'm happy to look forward to the questions and answers.
So that's a good pivot. I think it's time to get into some of these questions with the panelists. So let's start with Ramesh. I have a question for you. We've seen this technology being deployed, as we've kind of alluded to, in different contexts, and there's a lot of variance internationally, and even within here in the United States about strategies about what technology should be used. Why are we seeing such differences in this space?
Yeah, I think we're kind of held hostage to technology, smartphone monopolies or duopolies, and user behavior. So, in the beginning, there was a lot of innovation in the space: GPS, QR codes, Bluetooth, and so on. Singapore tried to build its own kind of a hacky Bluetooth-based solution, but eventually, I think we are kind of held hostage to what Apple and Google can provide. Fortunately, they work together, and one of the most beautiful collaboration I've seen in technology to create interoperable Bluetooth protocols now. So we're very fortunate that did happen. We have, I think, Bluetooth is dominating right now because it's supported at the OS layer. GPS, which in my personal opinion is actually extremely powerful from a public health point of view, and we have written many algorithms. Some of our earliest prototypes were based on GPS encryption, would be very helpful. Unfortunately, they're not supported the same way at the OS layer, unfortunately, because if you're recording GPS continuously in the background, every 3 days, your iPhone will say, hey, do you want to continue to record? And the user experience is going to suffer. I want to hear from Clint how he does that. So I think those frictions has made it very difficult for innovation. I think the European countries have complained to Apple and Google that this is stifling innovation, but that's the way it is. And although the initial solutions from especially China and South Korea used GPS to some extent, I think they are not as viable anymore because they're not being supported. I think my hope is that the protocols will change in the next, say, 3 months to 6 months, and we can indeed include encrypted GPS at the OS level, and that could change the game. We already have a few papers out there.
Clint, Ramesh just kind of brought up your name is kind of different applications for this. We often talk about this technology at a country level or state level, but you're doing something different. Can you tell us about that?
Yeah, sure. I think there might be a way we can reframe this. I think as technologists, it's easy for us to focus on what technology is being used. Is it Bluetooth? Is it QR code? Is it something else innovative? But the real problem is not technology. The real problem is adoption. So we need to look for how do we get our population, whoever we're serving, to adopt the product, right? I know it's kind of obvious and maybe a lower level thing from a technologist's point of view, like us, but that's the fundamental thing. So SaferMe, we focus on businesses because businesses can get to saturation. They can get to full adoption, and therefore contact tracing is incredibly useful for them. Secondly, a business can act at the symptom level, so there's less privacy constraints at the business level. So a business already has a relationship with employees, they already share information, they expect to get safe at work. So that for all of those reasons, in my view, if I was looking for what's going to be successful in the public sphere, I'd be looking for what's going to be the most adopted technology, or can we build something that's shared and therefore a multi-platform technology. And I wouldn't say a strategy is one of separating a distributed system versus a centralized system. I would say it's one of business-focused contact tracing versus public contact tracing, and how do those two things interact well. So happy to talk about that and then some of the techniques that are going on. I'll try and stay within our area of expertise because there's so much knowledge in the room.
I'm curious how you're going to integrate that, how you're integrating the business with the state level or country level.
Depends on the country. So New Zealand, for example, they have an API and then guidance for business-focused contact tracing systems, and the business itself may. So you might not be aware, but some countries require contact tracing. especially in places where the disease is under control. It's often much more encouraged at the business level, not necessarily in the US. And so when that happens, the business can decide to pass their data on to the country, and then the country will go away and do the contact tracing. So we provide the data to the company, and then the company can push that straight through to the Ministry of Health in that country or in other countries. We can just do what the business needs. Does that answer your question, I guess?
No.
Yeah, so different countries are doing it in different ways.
No.
But it does create problem, right, Tom, to your point. Organizations like Clint are trying their best to provide services to the businesses. But, we have been in this game for the last several months, and it's always a moving target because protocols change, regulations change, APIs change, server code changes, and so on. And keeping up with that is going to be very, very challenging going forward. So the approach we have taken at Pathcheck is just create a very large code base so that anybody can compile it, and they can just have compile time flags and feature flags. I want GPS, I don't want GPS. I want Wi-Fi, I don't want Wi-Fi. I want QR code or not. I will take Apple, Google, Bluetooth, or somebody else's Bluetooth. And they can just compile that. We have it in dozens of languages. They can compile it once and focus more on solving the problem for epidemiology as opposed to worrying on the code development. So that philosophy has helped us to work with many, many, many partners.
No. Yeah, and we see a lot of these breakouts in companies, in the United States, we've seen it in meatpacking factories where we've had these kind of super spreader events. And so certainly can see the application and the need from the business community. George, you also have we talked a little bit about another interesting application in healthcare, specifically using this technology. Would you be able to speak to that?
Sure. So when Clint talks about businesses, I think of hospitals, which I'm sure is not what he's thinking of. But hospitals use contact tracing quite a bit, and they're obliged as part of their employee health to understand how transmissions occurred to employees to make sure that it's not hospital-based or nosocomial transmission. And then we also extend services to dependents, to their families if needed. Using these proximity applications in hospitals is tricky because there's a lot of lead in hospitals. It's probably the greatest use of lead still in the Western world is to put it into walls, into particle board that divide walls around radiologic suites. So you can go into total dead zones in hospitals without trying at all and have no idea you're in a dead zone. The other thing is that, who's on one side of the wall, who's on the other side. The proximity stuff it gets a little complicated. But I think UCSF is interested in, it has been talking with COVID Watch, this 501, I don't know if they're 501c3, but they're a nonprofit that spun out of Stanford. And I think we're going to give that a try at some point in time. I actually work much more on the community end of things, and that's probably not the right time to talk about it now, but I'm happy to talk about it going forward. But you remember that hospitals are businesses too. They have real need for contact tracing. They have real big exposures. They have real big liability and have a real need to know. At the end of the day, how do hospital employees get exposed? By going into the lunchroom and taking their masks off like idiots. Right? So,
I may have observed that a couple times.
I can't imagine that you've seen that as well.
Mo, I think there's a question that a lot of people probably have about this: is how do you get people to invest in this technology? A lot of this is being done as a public good, but like Ramesh was saying, you have to pay for software engineers and people. How do we sustain this effort, especially if we're looking at COVID for 12 months, 24 months, or longer? This could be a key solution to addressing this pandemic.
Yeah, it's a great question, Tom. And I think for the broader public health problem, I think organizations like Ramesh's are great because I do think you need it's not going to be just a winner take all for-profit company. I think you do need nonprofits aggregating data. You do need, governments involved. It's challenging with the U.S. government, but I think there still has to be state level, municipal, and hopefully federal kind of support for something like this. From a investment perspective, especially venture capital, we're looking for companies that we think can achieve massive scale, and then have some kind of business model that allows them to monetize whatever asset they may have. In this case. A lot of what Clint has said resonates, because I do think businesses, including hospitals, are interesting places to start, just because people are already thinking about moving from work from home to a return to work mechanism and how to do that safely. And so I think there are ways that you could monetize an application here selling to businesses as a way to, especially if you think about self-insured employers who are already paying for their employees' care. Something like this is very interesting to them from a liability perspective, and also in terms of providing the right care at the right time for people who may become infected, and be able to prevent super spreaders, especially if you think, not just office environments, but a lot of our companies work with manufacturers, logistics, people who are working in warehouses. And so there's a lot of, I think you had mentioned a lot of the, super spreaders came from places like, meatpacking industries and things like that. So, I think it's a hard thing because it's so new. And so I do think, distribution will be pretty important, showing, how do you get people to actually adopt this? I think, some of the, in terms of foreign countries, what we've seen, governments have sponsored things, but from my understanding, it's been relatively low adoption. So I do think distributing through businesses could be an interesting way to get people to adopt, because you sort of require employees to do that so they can come back to work. And then, I think for venture capital, it's can you scale this and really monetize it? Can it become something that's actually at pretty significant scale? And so that, to be honest, is still an open question. I mean, this is still so new. And so there are I think all the startups that are doing this are relatively early, or there are other companies that have kind of pivoted into the space. So that still remains to be seen, but I think that the potential is definitely there.
In talking to adoption, I want to ask a question to both Ramesh and Clint, because you guys are founders of these companies. What are your plans for getting adoption, and what are your plans have been, and what do you think is a successful approach?
Clint, you want to go first?
Yeah, mate. No worry. We haven't had a problem selling. I'll tell you that for free. So we were lucky that we've been off building this crazy. Well, at the time it was crazy, but now it doesn't seem so crazy. Functionality that is useful for contact tracing. So we were lucky to be first to market, really, alongside PwC Check-In. I'm not sure if you're aware of that product on the business side. I think Ramesh and I actually agree on a number of things. One, I don't actually think for-profit businesses can do a really long-term effective job serving the public. So serving governments and state level, I think that's probably a tactical mistake, although I could be wrong. But likewise, I don't think not-for-profits can do a good job serving businesses. So I think there's actually the profit. What I've seen over the period that we've started is a massive increase in competition. So to your question about how do you get a startup funded, one of the nice things you want to look for is no competition. And I wouldn't say that's the case. And
why this profit-nonprofit distinction? What about a nonprofit would make it less effective at a business level?
A number of things, but obviously the obvious ones are a profit business can reinvest its profits into growth. And as Ramesh has remarked, getting funding for developers is expensive. Marketing is expensive. Likewise, investors want to own part of the future. They don't want to own part of a charity. I mean, I'm being relatively glib, but that's life. And I would say America's really great at capitalism. Like if you're good at anything, it's good at business. And I'd also say that a business's incentive to defeat COVID is actually incredibly well aligned with the country as a whole. And I actually thought it was a misjudgment, I guess, in the Apple-Google partnership to a degree, not to allow that kind of distribution, although incredibly good for us because it left us with a product that's, functional and really at the time, without peer. So anyway, long-winded answer, but it's a fascinating area. So with regard to adoption, there's really three types of rollout that we see in a business. We have managed devices, which is your top-down SSO rollouts. We have unstructured rollouts, which is a business almost never thinks they have this, but they almost always do, which is when a business doesn't necessarily know who's working for them. And we have to roll the product out in a way that's from the bottom up inside a company. And then we have bring your own devices, where we have to roll out in a different way to a bring your own device group within a company. So we can do all three. There's different techniques for each way to roll the product out inside a business. But we can typically get, if we've got the right data, we can get to 80% plus adoption inside 2 weeks. So it can be quite fast. And we've done, multi-thousand user rollouts. And what we find on the ground, like people who are working every day, they want a safe environment, right? Like it's managers that are caring about privacy. It's government that cares about privacy. People on the ground, they don't want to get sick. They want to come to work, they want to make money, and they want to be safe. And so we're not having a problem getting the product out there. Not for businesses anyway.
And just before Ramesh, I want to give you a chance to speak to this too. I just want to remind those watching to put in questions for our panelists. We'll be the top of the hour getting to ask some of those questions. So Ramesh, adoption, how do you do it?
Yeah, first of all, nobody knows what the right answer is. I think, George, who has like years of experience in manual contact tracing, I don't think that's scalable either in the current epidemic. So I think we're kind of stuck in the middle. It's too big, it's too complex for manual contact tracing, and adoption is not large enough to help digital contact tracing. So we're kind of stuck in the middle right now. Nevertheless, if we do believe that at some point, the estimates are 60% of the population could have, the Bluetooth apps, let's say, I think we can start seeing some really interesting outcomes from that. Professor Pico here at MIT, in her simulation for IDSS, she has shown that if 50% of the cases can be traced, then we can bring the R0 to 0.5, even if there's no masks, no social distancing, and no widespread testing, right? Just for the sake of simulation. So that's kind of an interesting news that as we go forward, we can't be living, I'm not opposing masks at all, but we can't imagine wearing masks all the time, right? So I think it starts giving you this early warning systems and so on. At the same time, I think Clint hinted at this, we're thinking of exposure notification as some kind of this magical hammer that will solve the problem. Actually, in most cases, it's okay to have a wider net. So for example, it's okay to just tell people on a given floor at a given time, saying, hey, there was somebody on this floor who was infected. You don't need the 6 feet, 15 minutes, all the fancy technology, all the fancy calculations. And then the people, even if you cost a net that's 10 times more than what you should have, if 10 times more people get exposure notification, that's not a bad thing, right? Because those people can just, again, check whether what was within a 4 to 7 day window, do they have symptoms? Are they at risk? Can they be just given sick leave and so on? So what we have noticed, we also work with a lot of businesses, a lot of universities, who, we have a large Harvard hospital, George, you might want to know, who's using SafePaths for 15,000, hospital individuals. And for all of that, we have realized that as technologists, and I'm a technologist, we try to kind of boil the ocean and try to get accuracy for proximity and time and this and that. And that's a completely wrong problem to look at. The right problem to look at is really a UX problem. It's really a triage problem. And if you can solve that on a smartphone, then we're in a much better shape. Yeah, and so it doesn't really matter whether you have GPS or Bluetooth, and the adoption can come through businesses, can come through universities, any of these captive audiences, and hopefully the rest of the population, because as we go forward, our life is going to depend on these apps, whether we are allowed to get into airplanes or trains or workplaces, and, can we be sure our testing is right and so on. So I'm not so worried about adoption, actually. I think it'll become part of our life.
George, as an epidemiologist, how do you see this technology fitting into the things that we're already doing? And how important do you think it will be?
Well, I mean, so 70% of the people we trace barely speak Spanish. Most of them speak Indian language, Mayan languages. Okay. These are the guys standing in front of Home Depot looking for day labor and their families and their pals. Okay. That's where this epidemic is in California, at least in the parts of California that I see. And it's, this idea that they're going to have phones. I mean, they have phones, but they share them and they pass them around so they can call home. And it's sort of, I think this works great. And I mean, let me compliment Ramesh one more time, because I'm a big fan. Ramesh's take on this is we're going to take 20% of your workload away, to which I say, thank you, Jesus. That's great. Okay. That's great. But understand that the core here is what I'm talking about. And that's why I've been a little bit skeptical about all this. Now, I will quickly point out that there was the University of California at Berkeley, man, it wasn't their fault, but of course it was. They managed to have an outbreak of 72 cases at some fraternity party. Why the fraternities are open in the middle of summer is beyond me. There's now another big outbreak at the University of Southern California in Los Angeles around a fraternity party. Okay, those are the people who are going to be walking around with their face down in their phone all day long. Okay, perfect for that population, and I think that's brilliant. I think that's great. But for my guys standing in front of Home Depot looking for day labor, I'm not so sure how well it's going to work. Now, there is a guy at Berkeley whose name I can't remember. He was a electrical, computer science guy, who sends me pictures of like homeless people sleeping in the street, and he asks them to hold up and show me their cell phones. So, and they all seem to have iPhones. Whether they work or not is another issue. But they hold them up, and they say, his point is that the digital divide is not as much as I think it is. Okay, maybe not. But I really like Ramesh's idea of we're just trying to take off 20% of the workload, or maybe 30 or 40%. Fantastic. Yeah, so the other thing I worry about.
And do you?
Go ahead.
No, go ahead. Go ahead, Drew.
The other thing is it because we're always going to come back to the same people in the same neighborhoods, and we don't really understand yet about reinfection, that basically people have the risk are at risk of being permanently quarantined because they're always going to be named as contacts because they're hanging out at 24th Street, the 24th Street Transit Hub in San Francisco, which is a big transit hub for the Mission District, the big Latino area of the city. And, they know, they're going to get named again and again and again and again and again, and basically are never going to be able to work. Now, the city San Francisco provides minimum wage if they have to go into isolation or quarantine. But still, I mean, remember that in SARS, the original SARS in 2003 in Beijing, there were 20,000 people quarantined. Of that 20,000 people, 5% developed SARS. 5% developed SARS. So 95% of people were quarantined unnecessarily. So, I want this quarantines decisions to be as specific as possible. I want it to err on the side of being precise, and I want the people who get quarantined to come down with disease. Right? That's otherwise people are not going to do it anymore. Right? It's as simple as that. It takes a lot to get people to do this stuff and to trust the government, especially with ice breathing down their necks and stuff. So, that's kind of that's where I'm coming from in all of this. But I love the idea of taking 20% off the top. That's great. I think that's a good selling point. And you can have the hospitals with all the lead-lined walls and the nurses unions go for it, right? And Clint, help with businesses. That's great. But these are the guys we're dealing with, right? This is where the epidemic is.
And I so agree with George on this multimodal aspect of it. Certain segments of the population need certain solutions, and the good news, there's a very nice simulation by the Oxford team which showed that although you might think that you need 30, 40, 60% of the population, the encounters fortunately happen within the same community. So people who have smartphones interact with each other more, and people who don't have smartphones interact with each other by themselves. So it kind of works out, this semi-segregation, at least in the mathematical modeling of that. And so, yes, I mean, if for every community, if there is a solution, hopefully collectively we can chip away. And the discussion George and I had a few weeks ago was about that. If 60%, 70% of the population have smartphone, at least those 30, 40% of the encounters will be taken care of through a smartphone-based solution. So George and other manual contact tracing teams can just focus on the remaining 60, 70%.
If we're successful in doing this from a public health standpoint, and this digital contact tracing really is effective, do you see this changing how the investment in digital health in the future, the landscape, not just for digital contact tracing, but for other digital health solutions?
Yeah, digital health, remote health monitoring, virtual care, those I would argue those have, there have been certain areas that have been almost net beneficiaries of COVID, in the sense that it's obviously been a horrible thing we've had to deal with, but there have been some businesses that have been able to, step up and provide either care or access or distribution or remote monitoring, different ways to kind of help people through this and manage. An example is one of our companies, Lavanga, which provides remote monitoring care for diabetes patients, and they've been seeing a massive uptick given now remote care has become so much more important. So I do think digital health in general has already seen a lot of investor interest. I think hopefully it encourages more and more founders to go after this. It's a huge market. It's very complex in the U.S., but I think they'll, this is, COVID is probably the one thing in kind of modern, history where there's been a true economic shock. I mean, I think we've seen, there's been the financial crisis in 2008. There's been, in tech, there was the dot-com bubble in the 90s. But, I don't know if we've ever had a public health crisis and economic shock in the economy at the same time. I think that has been fairly unique. And so I think it has definitely drawn attention to, different solutions that can enable within digital health that can enable either new forms of care, how we distribute that, new tools. And so I think contact tracing will be a part of it. I think it will be very important. It's very clear from George's work, this has existed pre-COVID in manual form, not necessarily digital. But I think it'll be an important toolkit. Even, let's say theoretically, we've come up with the magical, vaccine that the president has promised, and we've gotten past COVID. I think this will still be an important piece of how do we do digital health in the future.
Yeah. Mo, can I ask a follow-up question?
Sure.
I feel.
So I want to pivot here sure.
Looks like there's a delay. Mo, I think that's such an important point you made. I'm just trying to understand the difference between, at least in terms of investments and in terms of what kind of deal flow you're seeing. Is exposure notification considered kind of common good and there's not much value to be made out of it? And case managements and supply chains and keeping businesses open, what kind of distribution are you seeing? Because we think exposure notification is pre-competitive and it's not right for businesses. But what are you seeing?
It's been a number of companies that have almost have that as like a feature of something else that they're building, right? And it could be, kind of remote monitor. I've seen everything from, companies talk about how they're going to have, deep learning based computer vision. So using AI based computer vision and have that with thermal sensors essentially in like manufacturing environments. And so, can you track people who not only via self-reporting, because I think a lot of the contact tracing, and the expert should correct me if I'm wrong, but kind of rely on someone self-reporting. I've seen businesses also talk about active monitoring of people who might be in a manufacturing site or in warehouse, and so they've kind of talked about some of this messaging in the form of, or this communications platform as part of a feature in a bigger piece around how do we keep the workplace safe. I think everybody's trying to figure out, we've seen, I'll tell you, like in the first couple quarters of this year when COVID really hit, it was all around various remote tools like the one we're using today, like Zoom, to kind of enable, remote-based work. And now, as we're thinking about at least, and hopefully can actually achieve coming back to work, people are thinking about what are all the tools that we need to actually enable that in a safe way for businesses, for hospitals, for whatever it may be. And so it's been in that sort of context. In terms of wide deployments, I haven't seen that yet from businesses at scale, but I think people are trying to figure that out.
Are you at a stage where, if I can have one more question, are you at a stage
Sure.
where you just have a fatigue? It's like you see one more COVID-19 slide deck, and you're like, okay, this is it. I just can't take it anymore.
Honestly, every startup I've been pitched now has a COVID-19 slide deck for how they're going to survive through COVID-19, or how they're going to, they're enabling something that will help us deal with it, right? So, I've seen it's actually been really exciting. I mean, we've seen a lot of, I think when there's crisis, there's opportunity as well, right? And so I've seen a lot of founders rise to the occasion and figure out, hey, how do we get, our technology, we have computational drug discovery companies in our portfolio. So they're trying to figure out how do we get this to potentially help us predict something that could be an antiviral for treating COVID. And then there have been, kind of remote software tools that have tried to figure out how do we make this available to hospitals, to public education. So even in areas outside of contact tracing, we've seen founders really step up, which has been amazing, and give away their software for free if they need to. But I think, with contact tracing, to solve the public health problem with this, I don't necessarily think it's going to be a startup. I do think you need organizations like yours involved, people who especially given the privacy. I mean, in the U.S., I think there's a lot of concerns with, governments potentially tracking people. And so getting people comfortable with that sort of thing, I think it does have to be something that's not an Apple or a Google or that perception, because I think that will hurt the cause.
All right. I want to give an opportunity for our guests to ask you guys some questions. So we've selected a few of the questions and then put in. And the first one is, and I'll give everybody an opportunity to answer, whoever wants to. Who pays for digital contact tracing for the general public now and in the future? In Marin County in the Bay Area, we're doing manual contact tracing with volunteers, and they have to be licensed healthcare workers. What does it take to pivot to digital contact tracing of the general public at the county level or at the state level?
Yeah, I can give you estimates for the digital. Maybe George has some numbers for manual. For digital, I think the cost is about $1 per person per year for a given population, if we assume 0.1% infection at a given time. So that's the sort of estimate, and that's separate from, of course, the capex. And then you might spend anywhere between $1 million to $10 million to set up the initial app and the server, and after that, it's about $1 per person per year.
So I can tell you that in Marin County, aside from half the cases are in San Quentin State Prison. Okay, that's not going to work for digital contact tracing. The other half are among the poorest of the poor living in the Canal District of San Rafael. maybe not. I'd say it's going to cost whatever the startup costs are, and maybe it'll help a little bit, but I would hope it might help a little bit, but as Ramesh says, we're only trying to take up 20% off the top. I mean, where this is going to work for the guards at San Quentin. Okay, let's be really clear. That's where the disease is spreading now in Marin. By the way, San Quentin, which is a prison, an old prison, state prison that sits right on the bay on about $1 zillion worth of property, total bayfront property, has currently 60% of the inmates are infected. And we're thinking that this may actually be what herd immunity looks like. And a good 30 to 40% of the guards are infected. And they don't wear masks because they're tough guys. So, that's what we're talking about here. So that's the reality of it all. And okay, if there's something breaks out at the College of Marin or one of the high schools or something like that, I completely give you that this will work, but it's not the population we're looking at.
Yeah.
Why don't we give all the inmates cell phones? That'll be good. I'm going to hardly wait for that bill to come in.
Clint, can you share how it works on the premises side? What do the numbers look like in terms of expenses and how you charge them?
For us? It doesn't cost anything because it's all going to get passed off to FEMA.
We charge $19 a user a month. So the business pays obviously, and the staff members get it for free. It's part of their.
$19 per employee per month. Okay.
Correct. Yeah, I think it's probably worth mentioning the other demands that businesses have, because contact tracing is actually one component of what they do. So daily check-ins is the most common secondary thing. So in my view, a contact tracing product for businesses should have both of those functions together. It actually serves a couple of purposes, but the obvious one being that you can start intervening at the symptom stage, which is great, because then you're stopping spread within the business and the business can keep running, or you're only isolating, say, 5 or 6 people rather than 500 and shutting the factory down. So there's great demand from the business, and the actual cost of the product is really not expensive at all compared to shutting your operation down. Or, there's some legal suits coming through now. You Americans are good at that as well. You're good at that as well. Excuse me for saying. We're seeing that as well. But there's a number of other features and demands that businesses have, and they are really actually doing quite a good job. We as I said at the beginning, we've got rollouts all around the world, and American businesses are actually, a lot of them are taking on part of the role that we would see in New Zealand or the UK or Australia, where the government will actually take a centralized approach to response, and they will do the testing and they will do try to do isolation. But in the US, the big businesses are actually taking that on themselves. They're doing testing, they're doing screening, they're intervening when someone has a symptom and isolating the right people. And I'm actually really encouraged by that, because a business can act much sooner than the public can. So the public apps will typically act when there's a positive test, obviously, whereas a business is acting at symptom, and that's important. It does make a big difference, I think. So I'm hopeful. I think I trust the American capitalist system, and I like to think that you guys will power through this one way or another. And I'm excited to watch what happens and learn and push and try and help make it happen.
And the $19, is that per employee per month? Does that work mainly when you have thousands of employees, or does it benefit even if you have, under 100 employees?
Yeah, great question. So when we were made free, so our product was made free in New Zealand, early April is when that contract started. So the government basically, so any business could have access to this if they needed it. And what we found actually is the value for a business goes up the more people they have. So if you've only got 10 people in your business, it's actually possible to contact trace relatively manually, sometimes without even a system. An individual in charge can take charge and figure things out. As soon as you get above about 150 users, that's when automation starts breaking down. So you have chains of command, bureaucracy internally, rollout becomes an issue. So they actually need an enterprise-grade service. So anyway, the basic summary is we've automated the product for small businesses, so they just come on and start using it. But the price point doesn't seem to be an issue for the bigger companies, mainly because the value seems to go up the bigger they are. So yeah, it's an interesting space.
Clint, if I can ask a quick question, have you found businesses have already identified budget for this when you're speaking to them, existing HR budget, or ones that are self-insured, they've already got this kind of set aside?
Yeah, it depends on the industry. So some industries are under much more pressure than others. We've had, in the very early days, it would come out of the innovation budget. So it's funny, I say very early days, well, literally 4 months ago. The innovation team would step in and make it happen a lot of the time. And now budget's been allocated. What you'll find is businesses are already spending big dollars on screening at entry. So they'll often have people hazmat suits. They'll have temperature checking going on. And so we had one client come across that was spending $250,000 a month just on people at doorways. So, the real money has been spent to fight this issue at the business level. Yeah.
I want to get to another question that was asked of our panelists. For the U.S., when will we see smartphone-based contact tracing technology have a significant impact on businesses being able to reopen? For example, indoor restaurants. What capabilities in these contact tracing apps would be needed for restaurants and similar indoor businesses to be able to open now?
Yeah, a lot of
jump in here.
Go ahead, sir.
Go ahead, Ramesh.
I was just saying, we talked to a lot of players in this space. We are so immersed in this space, and it's really based on the risk profile of what we're talking to. We have done some UX studies, not us necessarily, but our partners, and what they always come back with is the risk profiles are so different. Often young people of course have a higher risk profile in terms of tolerance for risk as opposed to others. So and remember, exposure notification doesn't stop you from getting infected. It just gives you an alert that you may have been exposed. So if you are, at risk, immunocompromised, kind of a group, it doesn't matter whether you get the exposure notification or not. It's just whether you should do it or not at all. I think there's a nice analysis by Thomas Poyo where he says, if you just allow everybody under 45 to just go out and do whatever they want, as long as they can certify they will not come in contact with somebody who's older than that, we could probably get going very quickly. But I think, we live in a society where we can't be discriminatory like that. So it's a lot of that. It's coming down to orchestration as opposed to necessarily, I just don't see how export notification is going to give people that comfort going forward.
Yeah, it's a point I often explain to people is that if you have the phone, it's not actually helping you. You're being a good member of society because you either are putting in that you've been tested positive or you're helping notify people that have been exposed to you once you do test positive. And so really the people that are benefiting from the phone may not even, the app may not even have the app themselves. They're benefiting from you notifying people and then removing themselves from the population.
Yeah. So what we're working on now is thinking well beyond exposure notification and effectively creating, a risk score. And the risk score is based on things that you all can already imagine, like how many people in your neighborhood have it, what's the density, and so on. And based on that, you're getting a risk score. So right now, if you're in the middle of nowhere, clearly your risk score is low. But if your town has a trend of increasing cases, clearly the risk score goes up. So getting that is more meaningful than pure exposure notification.
I've got a couple of comments on restaurant and bar style contact tracing. It depends on what the regulators do. So in some countries, they will say, if you are opening a restaurant, you must contact trace, you must record who's coming in and out. Now, when that happens in a given country, there's a different type of product that springs up. So I don't know if this will happen in the US, but there's basically business-focused products. They can be wearables, they can be apps. Then there's the public government apps. But when there's mandated contact tracing at the restaurant and bar level, that's when the interface, we call them interface apps, but they're basically QR code scanning systems or logbooks that help a business record who comes in and out. Oftentimes, the person won't need to download an app at all. They might just scan a QR code, enter their details and say, hey, I've entered that premises. So there's a role for the regulator at the state or government level in the US. I don't know if that will happen, that if they say, hey, you have to do this to open. But when it does, when they do that, when we're seeing in other countries, it typically happens on the downslope, and there's an immense change in the demand profile for contact tracing when that happens. So we even see it when we see our sales leads coming in every day. We get more leads from areas where there's where the disease is coming under control. When it's ramping, businesses are kind of throwing their hands up in the air a little bit and saying, hey, look, let's just band down the hatches. So anyway, I've answered in a relatively roundabout way. I guess just to share with you what I could see coming for you if you ever get mandated contact tracing at restaurant and bar or any public interface type business. And that's relatively common worldwide.
And those QR codes, those go back to a health agency, like public health agency?
Typically, the business will keep the record, and then the health agency will call on the business for that record. And so so you have your internal contact tracers at the health agency, and they'll say, okay, we have a case, we know it went to this particular bar. They'll go, okay, bar, give me all your contact tracing data so we can do our job. So that's what, for example, in New Zealand, there's an API system which the interface apps can use to, on the behalf of the business, just transfer that data across in the right format so that your internal contact tracers have better data to do their job. So I guess that's what I was trying to get at before, where there's two parts of a good strategy. There's the business side, and there's the public apps, and really it's how they transfer their data back to your public health authority, and in what format that allows the public health authority to respond fast. That's it.
I'm going to ask a couple more questions. I think we have probably time for a couple more. Somebody asks, how do these systems interact with GDPR and EU regulation when addressing international tracing, either for public health or within corporations?
Yeah, and most of this data is decentralized, and almost nothing is. I mean, GDPR is about confidentiality; it's not about privacy. So think about the three layers: there's confidentiality, there's anonymity, and there's privacy. So most health systems just stop at confidentiality. Anonymity, some of them enter, but almost nobody goes into privacy. But the systems we're talking about here are private, which means there's no re-identification and there's no retention. So I think most of the systems are compliant, even much well beyond GDPR. The challenge, however, is localization, which is, and if you travel from one country to another or one state to another, even if this is not personally identifiable data, why should one country give the data to a neighboring country is a big mess right now. And even Apple and Google don't have a clear solution for it. So the so-called traveler profile or a tourist profile that's been debated. There's a notion of, kind of coalitions of neighboring states to do something together and so on. But there's no clean solution. If you go from one continent to another, why should this country give the data to another country is a big mess right now.
And are we seeing what are the solutions that we're seeing? Are there any solutions?
I mean, the best solution is people should say none of this data is personally identifiable anyway. So let's just make it available as a global, a global lookup table effectively, and we'll be fine. Because even at the peak of the pandemic, the Bluetooth keys won't be more than a few megabytes, few tens of megabytes at best. So even if you merge all of them, it's not that big a data set. But again, I think it's going to take some time before that's resolved, unfortunately. We wrote a paper right in the beginning of how this federation could work of different Bluetooth keys or GPS keys. And we put it out there, and we got good response. And then Google server, the version 1.5, supports that kind of in an intrinsic manner. Nevertheless, it's still segmented by regions or countries or continents.
Interesting.
All right. We have somebody asking, do you think tracing system may be introduced in school as a concept in colleges so that people being in the position of it, I'm not exactly sure what you're getting at here, may be able to live in a responsible and relaxed way. I think that question kind of gets at what we were just talking about with the bars and restaurants. I don't know if anybody has anything additional there.
If I can just say one sentence about that. My expectation is that there are going to be protests in the street when schools and employees start realizing that their employers and their administrators have bought a system that does something finicky. It's not privacy preserving, it's infringing on their freedom, and something is going wrong. So my expectation there will be protests in the streets very soon.
For this use in colleges and universities?
Yeah, because private employers and universities are treating this, hey, people are on my campus, I'm allowed to know what they're doing. And what they don't realize is that it's okay to track an individual, which is, actually not okay, but maybe it's slightly okay. But the fact that you can track two people are together, and if they have any kind of a colorful life, the fact that two people together is actually an even more invasion of personal freedom than tracking an individual. And so, we had done some analysis on the side, and people are extremely uncomfortable about this. They don't, even if you can track that one person, they don't want to know who they were with during their breaks and, during their off time and even otherwise. So this is going to be a major challenge going forward. I think the unions will stand up, the student groups will stand up against it. And it's better for cities and employers to use a decentralized privacy preserving solution on day one.
Dr. Rutherford, somebody asks, are we doing contact tracing well in the US? Is it working? What isn't? I definitely have my opinion on that, but I'd like to hear yours.
When you have enough people, it works okay. The problem is having enough people. And, in my hands, this is very, very labor intensive. Each case takes an hour to interview. Each contact takes a half an hour to interview. You do the math, right? And so it's in San Francisco, we have about 100 people doing it. Los Angeles probably needs 1,000. I think they have 800. So, it's not one of these things where you fall behind. If you're not getting them as fresh cases, within, say, a day of the specimen being drawn, you're not going to be able to really stamp out the chains of transmission. What this is all about is identifying people who are infected and having them go into isolation. Okay, and all these delays with contact tracing just make it a mess. Now, in some places with very low incidence, New Zealand comes to mind. Contact tracing has been more successful because there are fewer people that you have to find. But I think it's a mistake to think about this as having some sort of threshold value above which it doesn't work. It's just a question of having enough people. And one of the things we've been able to mobilize in California are people whose jobs are doing something else who can come in and actually do the more grunt work parts of contact tracing, like finding the phone numbers and getting the people in for testing and all those sorts of things. Again, my hesitancy here is about the non-specificity of telling people they have to go into quarantine. And if you think there's resistance about it now, wait until somebody has to go into quarantine back to back, because they get named as a contact. So, I mean, that's my hesitancy about the whole thing. And where's it working well overseas? Probably pretty well in some parts of Europe. It's not working at all in Latin America that we know of. I think it's probably worked pretty well in Canada. And then the Asian countries, which are very, very different in terms of what people's expectations are of privacy and non-interference in their lives. Back to you, Tom.
Yeah. I mean, I think contact tracing is really necessary, but certainly could be supplemented, I think, by this digital contact tracing. One thing I've seen is there is kind of what you were getting at. We just don't have enough contact tracers, and that creates a delay from your index positive case to when you're able to reach out to the exposures. And we've been seeing delays of 24, 48 hours. I don't know what you're seeing over there.
In terms of from the test to test result?
So for manual contact, from the test result to when you're actually, after you've interviewed the exposure, the positive case, and when you're able to reach out to their exposures.
Same day.
Same day?
Same day. That's the standard.
Test result?
Yeah.
That's great.
Same day that the case is interviewed. Test results, we have labs that are fond of giving us 1,300 positive test results all at once that they've been saving up for 2 weeks. So, we have to sort those.
George, do you have any? So we work in certain countries which has zero manual contact tracing operation, and they want to, deploy our solutions. Do you have any guidance at all? I know we would like to have manual contact tracing. What should they do? Should they put a 5-person team? Particular countries with tens of millions of people.
It's in our hands. You need if there are 8 new cases a day, you need 8 case investigators and probably about 6 or 7 contact tracers, right? Because it's an hour per case and a half hour per contact.
Right.
And if you get the contacts right, there are probably only about 3 or 4 who are really truly close contacts.
Right.
Now, this sort of the super spreader events are a different animal. We really haven't talked about that, but we think that you might be able to look at cycle times for PCR and try and pick out who has very high viral loads. Those with very low cycle times, like 15, have astronomically high viral loads, like 10 to the 7th virions in their nose. Those are the people who are going to be super spreaders, I suspect. So we try and prioritize those if we can get the information out of the labs, which is another issue. But I think if you're going to Bermuda and you want to do this, and they're getting 10 cases a day, you probably need a team of about 3 or 4 people. But you got to work through the weekends, because if you skip the weekends, there's no point in it, right? You got to keep going.
And what if they have nothing and they cannot even? I know you teach classes and so on, and I hope people are watching your classes, online classes. But what if they have nothing? Like they have money, or not money, but they have some resources, but they just can't stand up a manual contact tracing team. Do you think?
I would call, I call the John Snow Society or some fancy consulting firm to do it for them. I mean, if we're talking about Qatar and Bahrain, they have all the money in the world, but I'm talking about Trinidad and Tobago. Right. That's sort of more my speed. Right. Or Guyana. And they need to be, they have public health assets that have been paid for over the years. It's just a question of getting them trained and in the right direction.
Right.
All right. Well, we have run out of time. I want to thank our panelists for this really great discussion on an important topic, and VLab for having us. And I want to turn it over to Ira and the VLab team. Thanks, guys.
Thank you so much to all of our panelists. And this was a fantastic first virtual event for VLab. I want to just put a plug out for our next planning meeting, which is when our community comes together. This webinar format is obviously really different than how we normally engage as a community. So if you want to come engage and help figure out what the next most relevant topic could be, there are a few that we're planning that are in the works. But come to our next planning meeting, Tuesday, August 4th, and you can get involved as a volunteer. And of course, we're always willing to take sponsorships and donations. So I'll give a plug for that next, which is to say you can go to our website and donate. We are tax deductible, so it's 501(c) in the United States. You can get tax credit for it. I just want to give a huge shout out. I mean, this was amazing. We had panelists from around the world, different time zones, lots of different backgrounds, and it absolutely is incredible to hear about the different angles and the, Clint, I love your optimism for how our capitalism can hopefully prevail here in America. And I hope that everyone stays safe and that you try to stay well with you and your families. So we will sign off for now, but would love to have as many of you as possible at our next planning event, and we will hopefully have many more relevant topics to come. So, and we're also excited to try to explore new ways to engage with the community, and would love your feedback on what you in the VLab community would love to see next time in a virtual event, or if there's follow-up sessions you'd love to see, we'd love to hear it. So we'll follow up with the chance to give feedback on the event. And thank you all, and thank you especially to those who donated. All right. Thank you.